Hello, everybody, and welcome back to All Things Medical Assistant. I am your host for this podcast, Santino Tejas. And first of all, I want to thank everybody that's returned to continue to listen to what it is that I have to say. And for any new listeners, I hope you find this equally entertaining and informative. And if you know of anybody else that would find it such, please go ahead and pass along. For all of you new listeners, thanks for finding me and stick around. Hopefully, we can learn something together. If you've found me on YouTube, stick around and please watch the video. If you like what I've had to say, go ahead and like the video and hit that notification and subscribe to get notifications for further episodes coming up. And for all the subscribers that I do have, thanks for coming back. You can also find all my podcasts uploaded to allthingsmedicalassistant.com. Again, that's allthingsmedicalassistant.com. It is my webpage dedicated to this podcast. And there you'll find all the episodes uploaded in time as they're published and recorded, okay? So again, as well, if anybody has a comment, question, concern, there's different ways to go ahead and let me know. You can go to allthingsmedicalassistant.com, find my direct email, or you'll find a space to leave a comment, question, concern. YouTube, obviously, leave a public comment. And on anchor.fm, send me a voicemail. And I will go ahead and respond to it next week and present it next week. So thank you for listening. So this week was kind of hard for me to start the podcast. I don't know, just didn't feel like I had what I needed to produce this episode. And I still feel that way. I still feel a little, somewhere in the gray area. As I've explained before, I use the week's experience to come up with a theme, or I use something that's happened during the week, or an interaction that I've had, or something that I've seen on the news to use as a theme for the podcast. And this week was kind of not hard because it was tough. I mean, it's tough. Urgent care isn't an easy thing to work, but everything's been redundant in the sense where. Let me put it to you this way. So I watch the news, like MSNBC.com, right? I even follow Fox because I like to listen to MSNBC, and I like to listen and read what the crazy people have to say on Fox and everybody else that watches them. And I like to compare, and see what sounds, crazy or realistic. But, I can watch the news for 3-4 days, and it seems like it's the same content every day. The same headlines every day, so I'll wait 3 to 4 days to turn it back on and see if it's a different subject, but usually isn't. It's the same thing. It's just amazing how in this time of this pandemic, and this re-election time, people can just get stuck on one thing over and over, and then as one show ends at the end of the hour and the new one starts at the top of the hour, it's the same thing over and over and over again. It's frustrating. There's nothing new out there about what's going on today. Nothing new about the pandemic. There's nothing new about Donald Duck, and there's just nothing new about it. And so it's frustrating. So you hope that through your daily experience, there's something better comes along. And what's been redundant about this week is, boy, a lot of things. The first thing that comes to mind is this continued deception and continued lying by patients that come in. There's some days you see it more, some days you don't see it at all, but it's still happening. And this is what I mean. I touched upon in a previous podcast about how people are deceptive about this coronavirus as far as coming in for testing. Excuse me. The testing we have is reserved for those that are symptomatic or that have been exposed, that would have a reason to be tested. Is there a way to test everybody? I wish there was, because I think we'd be a lot further along if there was a way that we could mass test everybody, but unfortunately there's not. So you've got people that, are trying to find a way to get into clinic to get tested. And so they come in and they lie. Okay, they lie. Let's say, for example, somebody comes in, complaining about wrist pain, right? They come in, they talk to the front, they say, I've had wrist pain for some time now and it hurts. I can't flex, extend, I can't deviate, I can't hold. They give the whole story. That goes on, and in the back we read chief complaint, and then we bring them back, and then we do the initial, history and physical, or just get a little bit more about what the patient's issue is. And again, they go on about this wrist pain and how it hurts and what's going on and possible injury. Just go on with their story. And then the provider goes in, and the provider says, well, let's talk about this wrist pain. And the patient says, I don't have wrist pain. I have shortness of breath and chest pain. That right there is stupid. That right there is very inconsiderate. If you want to get tested, you go to your public health department. Without reason to get tested, go to your public health department, talk to them, and I'm sure they'll be happy to help you to test you. Okay, call your local health department, let them know your concern, but don't lie. Don't walk into a clinic and lie and say that you've had every symptom off the list that COVID presents with, or don't lie and say that it's something else when it's really one thing, because it's all a matter of exposure. So if you come into a clinic and you're embarrassed to say that, you might be exposed to COVID, you're embarrassed to say that you do have that shortness of breath or that chest pain or the fever, whatever, and you say, oh, well, my foot hurts. I want to be seen for a foot pain. And then you go and you sit in the foyer and you're out there for 10, 15, maybe an hour. And you come in and you say, well, no, it's not foot pain. It's actual, I have, symptoms of COVID. Well, then what you've done in effect is possibly expose people, because when you're sitting there and you're not honest, you stay around and you hang around amongst the public there, and you could be exposing them. And I am very thankful for the mandate of having to wear a mask, because it's very important. Let me tell you about the mask situation, in case some people are confused about it or why to wear it or what or who. There's still those those nuts out there that are thinking it's controlled breathing and whatever. But what it is for the masking is, we know this coronavirus to be of a droplet precaution, meaning when you sneeze, when you cough, when you speak, you release droplets into the air, and the droplets are light enough that they travel in the air, or by force they travel in the air, and anybody else that comes into contact with any open membrane, nose, mouth, eyes, they get the virus. So when you're asked to wear a mask, it's to keep everybody around you safe. Well, to keep you safe in effect as well. It's 50-50. So if I have coronavirus and I wear a mask and I'm speaking, I sneeze or whatever, there's a much less chance of me transmitting it to you because the mask is catching it. And then in effect, by you wearing a mask as well, you're not going to catch whatever might be residual that's out there. So primarily it's to keep the people from spreading it that are asymptomatic or that are symptomatic. It's to keep them from spreading it and other people, aspirating it or getting it in an open membrane. And that's how that works, in case y'all are still thinking it's controlled breathing or whatever, or it's infringing on your right. Again, I ask you, show me in the Constitution where it talks about wearing a mask, you idiot. So yeah, and that's still going on. Now, there's some days where it's better, and there's days where we don't see it at all. But still, it's a point. If you're going to go to your doctor, and if you're worried about it, fine, talk to your doctor. Let your doctor give you your resources, give you your options. Telehealth or whatever. Sometimes you don't even have to come into the clinic. You can just do a visit virtually by your phone or tablet or desktop. I just ask that people out there don't be deceptive, because you can either expose people or be exposed. And then if you're exposed because you went out there with a knucklehead issue, it's your fault. So it's very tiring. those of you that are clinically inclined, correct, fellow medical assistants, nurses, LPNs, CNAs, lab technologists, front desk, anybody that comes in contact with patients, it's very exhausting mentally. Not to say that anybody else's job isn't exhaustive mentally, but when you're in a situation where you're always having to think about what's going on out there, always having to think about your next step, always thinking about what it is you need to do, rely on that education, rely on that experience, because education is one thing, but experience is the second hand to it. You know, if you go to school and you learn all about IV therapy or how to draw blood, and then you do it once every 3-4 days. Well, let's say you get a rush of people in. You're going to be nervous because you don't have that much experience. Or let's say you hadn't done it in 2 years and you're expected to do it because it's within your certification. You're nervous, you know. So a lot of this, response in medicine is by practice, what we practice. And that's why sometimes we can tell what it is that's going on by your symptoms, because it's practice, it's repetition, it's happened over again. And we've understood the initial treatment and how it's worked, and we'll treat symptomatically, or we just go off of what historically we've learned and we know. So being in a process mentally all the time, hypersensitive in your area about what I do for every individual, because in the urgent care that I come in, or even in an emergency room, obviously everybody's different. Everybody comes in with a different symptom, everybody comes in with a different injury. You have to know what to do, or how to respond, or how to appropriately provide the appropriate care. We get people that come in very frequent that pass out at the door, or that come in withdrawal, or that come in with deep lacerations, or that come in with respiratory issues, that come in active anaphylaxis. We frequently get that. And right away, when the front desk staff is asking us to come out and triage somebody with active anaphylactic symptoms, you get up, you walk out, you're already thinking about, is it a breathing issue? Are they already having a hard time breathing? Have they stopped breathing? Are they cyanotic? Are they blue? What's going on? Are they responsive? Are they unresponsive? Do I need to do CPR? Do I need 911 for intubation? Do I need to give solumedrol? Or can we just give albuterol or whatever? There's all this, there's a thought process to it. And again, that reaction time, that response time gets better because of previous experience. So that's what our day is like. We look at, and we hear, and we listen, and we read, and we think about what's going on. We think about it all day long, even in between patients, because we're working on messages and phone calls. So, through the 10, 11, 12-hour shift, we're consistently on that trip of, of clinical judgment and clinical interpretation, So yeah, so again, like I said, not to say anybody else's job is not tiring or mentally, draining. It's the stimulation that gets to me, or gets to people after a while, So at the end of the day, when our brain is fried and tired, and you got people continually still coming in that are lying, it's just not cool. It's just not cool at all. Again, if you have a symptom, you have a concern, call and speak to your doctor. And I know the wait times might be extended, and I understand that. Then move on, find somebody that will listen to you. Or, if you're going to walk in somewhere, get to an ER and call from the outside. Or if you can go to an urgent care, call from outside. Don't just walk in. Be thoughtful. And it's just not being thoughtful to yourself, because what if somebody else is in there that's potentially symptomatic or asymptomatic, and you get exposed by them, and you're exposed because you just run around with your head up your ass, and you don't, and you're doing it selfishly. I'm not saying you deserved it, but you should have thought about it better. And that's my opinion. And that's what continues to happen. That's just what continues to happen. The deceptive, just like the politics and all the news about coronavirus pandemic and the death rates and all that. It's all the same news, but you don't hear enough about people making a difference. But you still hear people arguing about, who's got the better drug and this that. From what I understand, Moderna is going to be the one that's going to run the trial, or it's going to run the distribution of this vaccine, and they want to charge money for it. Yeah, so if I'm correct, that's what I heard secondhand, is that Moderna is a company who's going to take charge of the vaccine. And they're going to charge for it. They're going to charge for this COVID-19 vaccine. So I'll check this out. I'll study it and see if it's true. And I think people should be pissed about that. I think people should raise arms about that. I think people should let the representatives, their congressmen, everybody know. How can you do this? It is the government's job to protect us in many ways, not just in health, but financially, you know. So I'll look into that and I'll get back to you and I'll tell you whether I was right or I was wrong. And the biggest concern too for me right now is that we're coming close to flu season. Flu season. So this is going to be a horrible access issue for clinics, emergency rooms, urgent cares, and it's just going to cause a greater divide amongst people, I believe. Now, why do I say that? Well, the flu season comes around, and usually more so than not, if someone comes in with influenza-like symptoms, it's the flu. A lot of times people just come in with an upper respiratory, meaning just a common cold. Or sometimes people just have a transient virus or bacteria, comes and goes, and they're fine. But now, imagine all this issue that we've had with response to COVID, and now think of historically all the issues and response we've had to flu. Now you put those two together in the same during the same season in a pandemic. Man, what's that going to be like? And right now, it's more important than ever to think about, being smart about it, and exposures and containment, and being smart and not being so self-centered and selfish and saying, well, I don't want a mask, I don't want to do that, I don't know, why should I have an impediment on my right? No, it's not. You're being asked to be part of a solution for the interest of public health, because remember, you're within that public and your health matters too. Okay? And if you're just the type of person that's so mad and angry and thinks you know history better than everybody, and everybody's wrong and you're right, I pray to God, who I believe in, that this doesn't happen to your family, that it doesn't happen to your child, that it doesn't happen to your baby, your infant, that they don't get sick and something happened, or your elderly father or mother, that they don't get sick. Because I'm going to tell you something. How about this? Let's say your elderly father, elderly mother, immunocompromised spouse or child, okay, gets the flu. So they're compromised already, and then they get COVID. Well, I'm going to tell you, it's going to be a hell of a road. And you could have done something to prevent it, to be better responsive to it. Yeah, you're gonna have nobody but yourself to blame, essentially, because you don't want to just put that pride away, sit down, and understand that with what's going on, I need to understand, be serious, and be a better steward for the community. So think about that. Think about that. Just because you're not immunocompromised right now, just because you don't have underlying conditions right now, doesn't mean that you won't in the future. Because one thing may lead to another. What if somebody contains COVID and then they get the flu? Or what about somebody with asthma who's had pneumonia, gets the flu, and then they get COVID? And for all of you who don't understand that process, that step, let me tell you, it's not good. You've extended an illness and it's only gotten worse. And those of you that are medically inclined can understand that's pretty serious. So I'm sure, as this flu season comes in about, I'm going to have a lot more to talk about. And again, I'm just asking people to please understand and please take a minute and please sit down. No one's asking you to agree and be part of the system or agree with it. No, we're just asking you to please just be a part, for the moment, be a part of the solution. Okay? Be a part of what matters right now. And we can stop all this deception. We can stop all this exposure, or cut it down at least. Again, sometimes it's just too much. you know, and at the end of the day, I come home to my family after I've taken care of yours. At the end of the day, my coworkers go home to their families after they've taken care of yours. We take every precaution, we take every measure to be responsible enough to sacrifice comfort, our own health, to keep you safe. Now, we ask for it, and that's our job. We understand that. But if we can have the inclination or the moral to do it, to go to work continuously knowing we're going to be exposed, I'm thinking maybe you can find it within yourself to have a little bit of human decency. Decency, I know that's hard for some people to understand. Some human decency to have that consideration for other people. Now, all these people that are listening, that you know this is you, you know, I really hope that nothing bad happens to you, and I hope you're safe. All right, so my name's Santino Tees here for allthingsmedicalassistant.com. Go ahead and find me at allthingsmedicalassistant.com and leave a message and whatever. And YouTube, go ahead and thumbs up, subscribe, and like the video, notifications to be notified for the next upload. All right, well, thanks a lot, and let's be safe, okay? All right, we'll talk to you soon.